We are joined now by Huntsville Hospital's infectious disease specialist, Dr. Ali Hassoun. Thank you so much for being in studio with us tonight.
Oh, thank you for having me.
Dr. Hassoun, we reported today that researchers at UAB say that herd immunity could be just around the corner here in Alabama. What's your perspective on this?
I think definitely there's a possibility with that, but most importantly, people need to understand we need to get most of these herd immunity from vaccination rather than from infection. That's why we're encouraging as much as possible vaccination to happen as soon as possible to get to that level. It's going to take time, but there is a possibility that it can happen.
We also reported that second dose distribution of the vaccine is going much faster than the rollout of the first doses of the shot. What seems to be different this time around?
I think there's going to be more availability of doses, but at the same time, the logistic that get worked out. What is the best way to give the vaccine? Who's the best, where's the best places to give it? These are all very important. So I think it's a learning process that's improving with time.
There has been a lot of talk recently about the new variants of the coronavirus that have been identified even here locally. How concerned should we be?
So we definitely need to be concerned, but at the same time, all the data at the moment from the variants that we see that originated from the UK or South Africa or originated from Brazil, it seems the vaccine works for it. So these variants, I don't think it's concerning at the moment, as long as we get vaccination as soon as possible. But if we wait, there's a higher chance of more mutation, more changes, and more aggressive variants, and that's the main thing that we would worry about.
What is your final message to our community tonight?
Yeah, I think there is good sign. The infection rate is going down, but our guard should not be let down. It's very important we continue our prevention methods because we still see patients coming to the hospital really sick. So it's very important to continue the prevention. And if you get any symptom, get tested as soon as possible because there are available treatment that can be helpful, like monoclonal infusions, before get to the hospital. And then lastly, if you get to be offered the vaccine, please get it as soon as possible. Do not wait. It's very important to do it now and not to wait.
Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital, thank you so much for your time tonight and all that you do for our community.
Thank you so much.